and special guest, Dr. Bremner. How are you?
Doing great, Rob. Thanks for having me, Jay.
Oh, good. Hey, this month is it's Women's Health Awareness Month, correct?
That's correct.
Yeah. So what should we know about that, about women's health awareness? What kind of awareness do we want to get out there?
Sure, I'd say there's several things that come to mind. This month really serves as a crucial reminder for women to prioritize their health and their well-being. It also really empowers women by providing them with essential information and resources to manage their health more effectively. And thirdly, it encourages women to engage in healthy lifestyle habits, such as setting aside the time to discuss their health concerns with a board-certified gynecologist. And really by raising awareness and providing access to affordable health care, this month really helps ensure that women receive the comprehensive care that they need and they really deserve.
Doc, what are some of the examples of unique health issues that require proactive care for women?
That's a good question. I think several things come to mind. Things like an abnormal pap smear that screens for cervical cancer, birth control or contraceptive concerns, having heavy monthly cycles, issues related to menopause and hot flashes and losing sleep, concern about breast lumps and, concern that they might have breast cancer. I'd say all these conditions can really be treated and prevented even if they're identified early enough through regular annual screenings and checkups.
So when you say annual, the pap smears, that's an annual thing, or is that every couple of years?
Yeah, it used to be annual. Now it's spaced out, and they recommend that it's probably a waste of money to do it every year and isn't needed quite that frequent, but they say every 3 to 5 years. But unfortunately, when women hear that guideline that PAP should be done every 3 to 5 years, what they translate in their head is, I don't need to go to the doctor for 3 to 5 years. And that's really not true. I'll give you a couple examples. The Society of Gynecologic Oncologists, which is a fancy term for an organization of all the female cancer specialists in America, recommend, as well as the American College of OB-GYN also recommend, that women have annual complete physical exams, head to toe, every single year, even if they don't need a PAP. And a lot of women aren't getting that message. Listeners really need to consider when they schedule their preventative care or wellness checks, why are they going in, whatever frequency they choose. And I think for most of us, the reason we schedule preventative health care, my exam yesterday was essentially, I want some reassurance that I'm good in good health for the next year. If I'm not in good health, what can I do in the next year to improve my health over the next year? The only way you can do that effectively is through a very thorough, complete physical exam. For a lot of your listeners, it's very simple when you go to the car mechanic. If he just listens to your engine and says, oh, you're good, we'll see you in a year, and you're getting ready to go on a trip to California by, car, you want more reassurance than just him listening to engine. You want him to check, spark plugs and the oil and the tires, the whole shebang, to make sure you're safe for traveling that long distance. And
sure.
So that's really what your listeners need to be thinking about. And really by scheduling their annual women's health screenings, they can screen for cervical cancer, heart disease, breast cancer, as well as like blood pressure checks, lab work. Really, it helps emphasize the importance of things such as your mental health, urging women to stay engaged with their friends and family and really seek professional help if they're having some struggles with some of their mental health issues. All of those things are involved in your annual checkup.
Sure. So what about, here's something, we were 5 years into this or through this, when the pandemic hit, how did that impact women's health care? Did it impact it the most, or what was the most thing that impacted?
I'd say it impacted all of us, men and women, because I specialize in women's healthcare, that's what we're talking about today. For women, I'm really shocked that media doesn't talk about this more, because it really has impacted women's healthcare in a tremendously negative manner. When it first hit, we were faced with significant obstacles in obtaining our health screenings during the COVID pandemic, led to a lot of delays in diagnosis and or inadequate treatment, just trying to get by until we got through the pandemic.
Sure.
Initially, if you kind of reflect back, we all had a fear of, was it safe to even leave our home, kind of all hunkered down for a while. And then when you did get into the doctor, after a long waiting time period, everything took a lot more time because they had all these precautions we had to follow. And many women's healthcare providers also just kind of got burnt out during the COVID pandemic, so either during the pandemic or soon after they retired or left their practice and went somewhere else. I think your listeners have all seen that in Mason City, New Hampton, where they're just a lot less number of women's health providers than there were before the pandemic, just because people just had to move on. And so now there's less number of providers to go around. So you have to wait longer to get in. And so for some women, they really have to think about, starting all over again with a new provider telling your life story and new ways of doing things and new routines. And sometimes you have to even go to a different community to get the health care that you really need. And that's tough to get through that barrier. And secondly, in my GYN practice, we really understand the tremendous need for easier access to specialized women's health care, to remove those burdens and the hurdles, to make it easier for people to get in, get taken care of, and get back to work and the rest of their lives. So we try to offer same week, or even some cases, same day appointments for women to really help provide meeting some of that significant need for affordable and experienced women's health care in Northeast Iowa.
Yeah. So what are some of the things, doctor, that about your practice that's unique and or it distinguishes the services that you offer from the providers that women actually might receive healthcare from?
I would say there's probably 4 different things that come to mind. My knowledge and training on my practice is focused exclusively on women's health. I don't do anything else other than that. So I really have a depth and breadth of experience focusing on women's health. Secondly, because I'm board certified, women can be assured that I'm highly qualified and committed to quality women's health care. When you don't have board certification, sometimes the quality can drop off if they haven't sought that extra certification. The third thing is just my experience. I've been doing this a long time. I've been doing it for 40 years, and there's probably not many doctors in the state of Iowa or in the Midwest that can say they've had 40 years of experience focusing on women's health. And then lastly, something that's unique in our practice, I really have a special interest and expertise in evidence-based proven weight loss techniques for women of all age groups, teens, women in the baby years, menopausal years and beyond. Over 70% of our culture in America, and it's getting to be worldwide, over 70% of us are struggling with being overweight. So it's a huge, huge need to address that weight issue that a lot of doctors just aren't addressing.
Yeah. Do you have any concluding remarks at all, Dr. Bremner?
Yeah, I think the main thing is just Women's Health Awareness Month in May. It's really essential for promoting women's health and well-being. It serves as a great reminder to prioritize our health and seek annual preventative care through complete physical exams and advocate for better healthcare access. And at Regional Health Services of Howard County and Cresco, we really believe that empowering women to take control of their health this month contributes to healthier communities and families. And so if your listeners have any further questions, we can be reached at 563-547-2022.
Excellent. Always a great conversation with Dr. Bremner there at the Regional Health Center. Thank you so much for taking the time. I got one more question for you.
You bet.
And maybe your office doesn't do this, but when I got not me, when you have a doctor's appointment at 11 o'clock in the morning and I get there and get all checked in, and then we get sent back to the room. It's a conversation we all have. and then it takes another 15 minutes for you to get there. What is there a reason for that? Are you in a coffee break or what?
Yeah, no, it's a coffee break. It's just trying to thread that needle between patients that come in early and patients that come in late, and how do you adapt? I try to do my practice like an accordion, where I can expand it or contract it depending on what the patient's needs are.
Sure. You got to have had people ask you that before, haven't you?
Oh yeah. I think we need to, as providers, we need to respect patients' time. They're taking time off work. Let's get the problem taken care of and let's get them back on their day.
Right. Exactly. Well, doctor, it's always great to talk to you, and I look forward to, I don't know when we're going to do it again. Is it another month, every month? Or are we doing it to whenever there's an issue with like a women's awareness type thing?
That's purely up to you guys. I'm sure available.
All right. Sounds good. Doctor, have yourself a great day. All right.
Thanks a lot.